Work. Like, I'm not going to lie to you and say that exercise is an easy thing or a simple thing. It's not. It's complicated. It's a lot of work. Obviously tonight we're going to talk about that in relation to HRT. Allure does a lot of HRT, and that's only one part of the spectrum, right? We got to learn how to marry those two and kind of achieve that overall quality of life that everybody's kind of looking for. And it's a hard thing to do. You can only have the end game without doing both sides of the equation. So, my personal experience is I've worked with clients that have been kind of all over the place and NFL athletes and whatever, and then I got to the point where I've spent a lot more time over the last 10 or so years working with, regular people. And it's, believe it or not, it sounds less glamorous. It's way, way more rewarding to watch people that are in their everyday life that may be struggling with, whatever they're struggling with, depression, self-image, whatever it is, right? And go from that point to that quality of life. Now, not everybody can get there through conventional means, and that's where a place like Allure comes in, and something like HRT. And I can speak from absolute personal experience. It's probably a HIPAA violation if I tell people that I actually get implants, and I was on the young end, right? And I can tell you, I went through this phase where I was in my kind of like my mid-30s, and that's not really a time for most guys when you're kind of crashing and burning hormonally, but I was, and I didn't realize it. And I went through this phase where I was, kind of, everything was a little harder. I was tired. I had no drive at work. I was generally lazy, which was not something that was normal for me. I was taking really good care of myself. It didn't make sense. It took me about a year to get to the point where I needed to admit to myself that I needed some help and I needed to look at other options, right? And so I did that. And I came to Allure. I got some blood work done. I got with Michelle. I got my first implant probably about 2 years ago-ish. And it went from, I went from living life on like a 3 to a 10 over the course of a couple months, right? And it was like, honestly, it was like life-changing for me. It was unbelievable. And it was something that it was hard to do. I was just telling her about this earlier. Especially from the male point of view, it's really hard to admit that your body is not working the way you want it to work. That's a hard thing, and it's a hard thing for a lot of people to make that realization, like, okay, I need to get some help. It's hard to admit that you go through a little depression because you're not feeling good. You're kind of down in the dumps and you don't have much drive. That was a tough choice, but once you make that choice, it's life-changing. I mean, it was truly life-changing for me, which makes it really, really easy for me to stand here in front of you guys and kind of talk about this stuff. Now, the other side of the equation is that HRT is a great thing, right? It's going to give you a lot of tools. It's going to solve a lot of those problems. You're going to feel better. You're going to have more energy. For me, the sleep thing was huge. I was not sleeping at all. My sleep got instantly better. Pretty much all the symptoms that I was experiencing got better pretty rapidly. But the problem is, with this explosion in HRT, and we've seen it, what were we saying? You started this, Michelle, about 10 years ago. She said she was working, 2 half days a week, right? Doing HRT work. And now it's to the point where it's all day, every day, multiple offices, multiple providers. But the problem is, just because you're getting, those hormones in balance, it doesn't mean you're at that point where you're optimal or you're having that really great quality of life that everybody is kind of looking for. Because the insides are right, but you still have to be proactive. You still have to take control of your health, right? And that's the ultimate kind of underlying theme of this thing, is that, you can't have one without the other. I could try to exercise my brains out. I was eating really great. I was exercising. I was dying. I was just like, it felt like I was living this life that wasn't mine. Now with HRT, it's incredible. Like, I'm on 10 every day. I've been up since 4 o'clock this morning. I still feel great. I wouldn't feel that way if it wasn't for HRT. Now, I wouldn't be feeling that way if it wasn't for exercise either, right? So, I'll be honest with you, coming here and getting an implant every, 6 months is kind of the easy part. Does it cost some money? Sure. Is it a pain?
I'm sorry, what's an implant?
It's a pellet implant that they actually put subcutaneously that releases hormone over, kind of a length of time. And everybody needs it a little bit differently, so. Good question, though. And that kind of gave me the tools to be where I'm at now. So, from that standpoint, there's a lot of benefits, and it's great, but we got to take that extra step. And that extra step is really the fitness aspect, right? And that's what I've spent the last 17 years of my life for, realistically, like 55 to 60 hours a week, doing is talking to people about health and fitness. I mean, I do a lot of nutritional work. I know a month ago we did at this Wellness Wednesday, Dr. Moak did a whole seminar on fad diets and the science behind them. That was great information. I'm not going to go super in depth with nutrition tonight, but if you guys have questions about it, feel free to ask. I'm pretty sharp on it. I obviously spend a ton of time talking about nutrition with my clients. But the main thing is that active lifestyle that we're trying to stress. So, you know, the benefits of exercise, we've all heard them, right? I mean, they're kind of the same as TRT. You're going to feel better, mental clarity is better, you're going to sleep better, you're going to have better energy. All those things are true. All those things are true. Are you going to feel those things without HRT if your hormones are not balanced? No. The same thing goes for exercise. You're not going to get those same things out of exercise if you're not doing it. So, you know, they do mirror each other, and they do tremendous things kind of in conjunction with each other. So, you know, obviously you're going to get all those benefits, as well as obviously the reduction of all the major chronic diseases. We hear about those things every day. We hear about diabetes. We hear about heart disease. We hear about obesity. Those are the big three. That's what's killing America right now. And the realistic stat, guys, is that like 70 to 80% of that is preventable by physical activity. So what that really means is 70 to 80% of the actual chronic disease that's happening isn't disease at all. It's lifestyle disorder, right? And that's where we collectively have to kind of own that. And I hate getting, you know, soapboxy or preachy, but like collectively, like we need to do that. Like everybody hates the cost of healthcare in America. It's out of control. If we collectively controlled those three things, healthcare is not a problem anymore, right? And it's, you know, it's kind of one of those things where it starts with like, you got to look at yourself and say, all right, am I doing my part? Am I taking care of myself? Am I getting healthy? Do I feel good? Right? And those are tough questions you have to ask yourself, but you have to ask yourself those questions and be honest with yourself about the answers, right? And that's a hard thing to do, just like it was for me when I wasn't feeling it with my hormones, right? But the results are profound when you are brutally honest with yourself. So, you know, the chronic diseases are a big thing. Obviously, weight loss is a huge thing, but the end game is that quality of life. And that's what I'm here for. I do it all day, every day. I try to instill that with people. I watch people walk into me and the gym, for that matter, on an hourly basis. I watch it turn over the course of a 12-hour day multiple times. People come in, they're not smiling, they're not happy, they're crabby, they had a crap day at work, whatever it was, and they walk out happy, right? And that's it's like a simple fundamental thing in life. Like if you move a little bit, you're gonna feel better. You're gonna feel better. The quality of your life is gonna be better. Obviously, you're gonna be healthier. But the goal is to get everybody feeling really, really good. And these two things together are absolutely gonna do that for you guys. It's a huge thing. So, you know, we know where we gotta go. We know we gotta get healthy. We know we gotta move. And how do we get there, right? What are some simple things? And I'm not gonna, you know, bore you with simple, you know, equations and science. I'm gonna give you some basic bullet points. We're going to do question and answer after. I definitely encourage you guys to ask a bunch of questions about exercise. I'll go in as in-depth as you want me to at that point, but I don't want to, you know, talk it to death and give you all kinds of ridiculous examples that you're not going to remember. So the simple guideline, and this is like a simple guideline I give everybody that's at the beginning, if they've never done anything, 3 to 4 hours a week. Get your butt moving for 3 to 4 hours a week. What you're going to do within that 3 to 4 hours, you know, that's where things can get a little complicated. You can do some cardio, you can lift weights, you can be outside riding a bike. There's a lot of gray area there. We'll get into that a little bit later, but the simple guideline is you have to move 3 to 4 hours a week, okay? You can cut that up into 3 hours, or I'm sorry, an hour, 3 days a week. You can cut that up into 30 minutes, 6 days a week. However you want to do that, it's fine with me. 3 to 4 hour weeks is a very simple guideline, and this is the key to the whole thing. You got to make it count. You know, and everybody gets really mad at me for this, but like walking isn't really exercise. Unless you have some like circumstances or you have some limitations or you're at the very beginning, I'll count walking as exercise. But as you progress, you have to get outside of that comfort zone, right? Which leads us to the cardio part of this equation, right? So cardio is great. It's amazing for preventing all those chronic diseases. It will make you feel incredible. But the problem with cardio is that there's this equation. You have to have this balance, right? So within cardio, say if you go do your 30-minute cardio session, going for a walk, going for whatever, that's all great, but at some point you're gonna adapt to that. You have got to make that count. So a simple guideline, I'm not gonna give you like target heart rates because that's gonna be different for everybody. Use this as a simple example. If you can give me like 5 to 7 words in a row without taking a breath in between, you're not going as hard as you need to go. So you should be out of breath. Right? You should not be able to have a conversation with the person next to you if you're doing good quality cardio. Maybe in the beginning when you're not quite used to it, that's okay for, you know, a week or two, but as you progress through that, you have to achieve those high heart rates. You have to challenge yourself, right? That's what this whole thing revolves around, is getting out of that comfort zone and challenging yourself and feeling some stuff that doesn't necessarily feel the best to make that progression. right? So within that, cardio is amazing for burning calories, right? Everybody's heard about you go take a spin class or do whatever, you're gonna burn 1,000 calories an hour. That's great. But the problem with cardio is when you are done with it, you are burning no more calories at all for the rest of the day. So I'm not telling you not to do it, I'm just telling you that it's good for what it's good for. It's great for your heart, great for your lungs, great for burning calories in a short window. And you'll burn a ton of calories in that window. In 30 minutes, you should realistically get 200 to 400 calories if you're really, if you're all in, giving me good high heart rate like you should be, and that's a nice number. Now, like I said, the problem is when you stop, it's over, and that's where the weight training comes in. Weight training is fundamentally important for so many reasons. First and foremost, obviously everybody needs to get stronger, but from a metabolism, a basic metabolism perspective, weight training is like the king. Because when you lift weights, you don't burn a lot of calories while you're lifting weights. So you take that same 30-minute session, you might only be, 100 calories. So you're, on paper, it's 200 less. You didn't feel like you did as much work. But your metabolism will stay substantially higher for substantially longer. So you get a lot of afterburn out of it. So from a good weight training session, you're probably going to be in that 300, 400, 500 calorie range because you're going to get that basic boost of metabolism. So that's huge, right? That's free. The other thing that is unbelievably underrated is obviously when you lift weights, if you guys have never really done much of it, you're going to gain muscle mass, like quickly. So the average person puts on about 5 pounds of muscle mass within probably the first 5 to 6 weeks. It's really quick. It really is. It happens really quickly because it just totally shocks your body. And the beauty of that is and this is an important stat, listen to this, for every 1 pound of muscle you gain, you will burn 50 to 70 calories a day at rest, right? So those are free. And so if you gain 5 pounds of muscle, which really doesn't take that long, you're getting 250 to 350 calories a day for free. That's substantial. That's substantial because 1 pound of fat equals about 3,500 calories. So realistically, about every 10 days, you're going to lose a pound of fat by doing nothing after you've gained that muscle. Now, consider the fact that you're going to do some cardio, you have a little more muscle, you put that extra metabolism on top of a 300, 400 calorie cardio session, you might get ahead by 600 or 700 calories for the day. That's a big number. And that's where you're going to start seeing, significant improvements in, how lean you are, your body fat levels, all the stuff that everybody wants to see, never mind the health benefits, everything you want to see aesthetically, that's where you're going to get it. So you got to be real careful about how you structure it. And I see a lot of people come to the gym and they're only doing cardio, or they're only doing weights, and they never really kind of get there. And I'm sure everybody's probably been in a gym and tried some stuff and got stuck and didn't really explore the stuff that was kind of scary to them. For men, most men don't do a lot of cardio. Most women are not going to go hit the weights because it's scary and it's out of your comfort zone. But it's to get to that point, you got to get out of that comfort zone. So from that standpoint, super important to be doing weights. That's probably the place where most people fail, is they do not get out there and do it enough. Now, in terms of what you should be doing, and I wrestled with this for a long time because I had no idea what the experience level of everybody was going to be. I don't want to get into and again, you can ask later, but straight workouts. There's no one workout that fits everybody. Doesn't exist. I train, I don't know, I think I have about 30 people that I train right now. Everybody's doing something different because everybody's body types are different, everybody's genetics are different, everybody has different limitations. So I would beware if you see one thing that says this is going to cure you, this is the best workout. Doesn't exist, right? Doesn't exist. Doesn't happen. It's not real. And if you don't know what it is, that's where you need to kind of get with somebody who's a professional. No different than when you don't feel well, you go to a doctor. A lot of people try to self-medicate in the gym and figure it out on their own. It doesn't work, right? So it's a good idea, and I don't, it's not like you have to come to me or go to Powerhouse where I'm at down at 25 in Van Dyke. I don't care where you're at. No, seriously, I don't. I really don't. It sounds bad. My owners would kill me if I told you this. I don't care where you go. Just do something, right? And if you don't know what you're doing, talk to somebody who knows what they're doing. It's a short-term investment. It's going to take a little time, but once you have that knowledge, it's universal. It goes with you for the rest of your life, I've trained people for 3 months that I've watched just flourish over 10, 15 years and continue to get better because they took those tools and used them, right? No different than if you're not hormonally right, you take that HRT tool and you use it to get to where you need to be so you can have that drive to get yourself in the gym and get yourself encouraged on that healthy lifestyle. It's the whole thing, and from a feeling of well-being, it's the only thing. And I watch my clients do it on a daily basis, and it's like intoxicating for me, and it never gets old. It never gets old. So kind of circle back to the weight training. I think just general guidelines, probably 2 to 3 days a week, just like your cardio. I would split those workouts. If you're going to spend your 3 hours a week, I'd probably do 30 minutes of cardio, 30 minutes of weights. It doesn't really matter which one you do first or second. That's kind of a personal preference thing. You can make a great point Either way, and that's probably one of the more common questions is which one do I first? Well, honestly, I would kind of tell you to do the one that you would like the least. Do that first. Get it over with. It is. It just works. It works better that way because you don't tend to like half-ass it, for lack of a better term. I probably shouldn't swear either, but I can't not. So, sorry. I knew it was going to happen once. So do whichever one you like least. Do that one first. Get it over with. As far as sets and reps go, that's kind of a gray area too. Generically speaking, most people are going to do pretty well with 3 sets of each exercise. Probably something like 12 to 15 reps. And I'm going to give you the same talk I gave you with the cardio thing. It should challenge you, right? Like if you get to 15 and it doesn't burn, not hurt, you got to look out for joint pain, but like something should burn, right? We've all felt that. If it doesn't, it's way too easy. You're not getting much out of it. Now, if you're to the point where you can only do 8 or 10 of them, it's probably too heavy, right? Like we're not trying to be power lifters. We're not trying to be Olympic athletes. We're trying to get healthy. We're trying to feel better. We're trying to like have something that's kind of sustainable. You don't want to get hurt. So from that standpoint, you want to kind of live in that like 12 to 15 range. And that's a pretty good place to be. And again, a lot of it seems complicated when you go to the gym. It's not rocket science. It really just revolves around being super consistent with it, right? Like I keep myself in pretty good shape. I don't kill it. I work out 6 days a week, but I don't kill it every time I work out. I get out there and I put my time in. Today was like a complete joke in terms of level of effort, but I did it. I got in. I got my 50 minutes in. Was it groundbreaking? No, but it got done, and I will do it again tomorrow because I did it today. And that's part of what helps you guys develop those habits, and it's hugely important in terms of the consistency. No different than if you came here, got HRT, and then didn't do it again for another year. You're going to crash and burn. It's the same thing. It's the same thing with exercise, guys. You kind of got to make that sustained effort and make that commitment to yourself on both of them. And if you do, you're just going to go up and up and up and up, and you're going to feel better. It's something I can't stress enough. And like I said, I wasn't going to talk a lot about nutrition, but I think the one thing, if I'm going to leave you with anything about nutrition, is you cannot out-exercise a bad diet. I've seen people try. I've tried it. It's not possible. You're not going to go eat a bunch of garbage and hit the gym 5 days a week. I don't care if you're running marathons. I have literally watched clients run marathons, train for marathons, running 50 miles a week, gain body fat because they think it's like a free pass to go eat all the carbs and all the junk. It doesn't work. So I'm not going to get into like the semantics of nutrition, but you got to realize that it's a huge part of it in terms of the aesthetics, in terms of the health benefits. You cannot out-train that bad diet. Simply put, I think like 80-20 rule, 70-30 rule is a pretty good place to be with that. If you're eating, 80% of the food is healthy, stuff you should be taking in, that 20% is not going to matter. If you have a bad week at 70-30, you're probably still going to be fine. I mean, I definitely still take in my fair share of junk food, and it's fine. It doesn't touch me because the other 80% is really good. And you guys will definitely feel that same thing, but the 80% better be good. No different than when you're doing cardio, you better not be able to, have a whole conversation with people. It all goes back to that level of effort and making it count. And again, HRT will be that tool that gives you that drive and kind of gives you the energy to make that happen, but you got to take the next step. And if you don't, you're just going to kind of just stay on that same path, and that's not where we want to be. I would assume everybody that came here tonight is trying to look for that, like, what's that next step? How do I feel better? Where's the fountain of youth, so to speak? That's the fountain of youth. I can't stress it enough. It sounds cliche, but it's true. I see it all day, every day. Those who embrace it do amazing things, and those who don't just stay on that path. So, I definitely encourage you guys to kind of stay on that path. It's the best thing you'll ever do to yourself. It never ends. So outside of that, I wanted to keep it pretty simple. I don't really have much else to share in terms of like, the message is the message. So at this point, I would love to take a bunch of questions from you guys and feel free to pick my brain as much as you want. So anybody got anything? Don't be shy. I know nobody ever wants to ask the first question ever. That's true. You did ask. I'll give you credit. You did ask the first question.
Anybody else?
Yeah, go ahead.
I just recently watched a documentary about eating and being vegan. And if you're vegan, you actually can build more muscle.
Yeah, I mean, you can. Yeah, being vegan is not necessarily a limitation. You just have to be structured within that program. You still have to take in good whole food sources of protein from those plant sources, but it's absolutely not. It's not a limiting factor. You just have to be very diligent. I will say one of my bigger problems with going vegan is a lot of people take it so carbohydrate heavy because it's really easy to get away with eating grains and wheats and stuff, and that will make up the basis of that food pyramid for you. And that's not necessarily going to be the best thing in terms of body fat. So you got to be a little bit structured with it. And you kind of got to make sure you're not giving yourself the free pass to just pound carbs all day every day, because that's definitely not going to get you there. But it's not a limitation in terms of building body fat at all. I know many vegan endurance athletes, which is completely counterintuitive, and they do exceptionally well. So yeah, it's a good question.
2 questions.
Yeah, go for it.
So one of them was about the hormone replacement,
Yeah.
but does hormone replacement therapy affect the immune system in any sort? So I know you said that it makes you feel better.
I mean, I would defer to Michelle on this, but I would say typically it's probably going to enhance it. I mean, when you're low, I would assume your immune system is not going to function as it should, right, Michelle? I mean,
Yeah, no, it definitely doesn't affect your immune system at all.
yeah.
It doesn't or does?
Does not, no. I mean, I certainly haven't experienced anything other than feeling better.
Right, well, that's more what I was wondering.
Positive benefits.
Positive.
Yeah. I mean, I would say, yeah, it has. I mean, I work in like the most germ-infested environment on earth with people's sweat. It is. I mean, every gym in America is dirty, right? And like, I don't care how much you clean it. And I touch germs all day, every day. And I was definitely, had a lot of little colds and nagging things before, as opposed to now. And I'm sure it's because I'm functioning at a higher level. My immune system's stronger, and I can fight things better. So,
And
yeah.
The second question was, does the age that you get the hormone replacement affect like the natural tendency for hormones and their
Right, yeah, so, I mean, if you're low, regardless of your age, it's important that you replace, but yes, adding in replacement will affect your natural production.
Yeah.
So, when you're young, there are things that we do to kind of protect what you have as well, because we don't want that to stop. We just want to replace what you've lost.
Yeah, the goal is to like enhance and not necessarily shut down natural production, right?
Right,
I think that's a good way to say it.
Yeah, absolutely.
Yeah.
Thank you.
I just asked if you repeat the question for the viewers on Facebook.
The question was about.
Questions that come up.
Oh, okay, yeah, no problem.
How do you know you need hormone replacement? How do you know how much you need when it's replacement? You speak very generically.
Right.
And so I don't hear much, a little more detail.
Well, we brought him in is more,
Yeah, I'm like the exercise component, but I mean, the idea
Right.
is to get the two together. So your question is
we're like
completely
working
great.
together on this. So
Yeah.
the question was, how do you know if you need hormone replacement, and how do you know how much you need, correct?
How often you
And
need
How
how
often
often
you
you
need
need it, okay.
How, what, when, where?
Right, so typically when we see patients, for an initial consult, we do blood labs to check their levels. We do a whole hormone panel for both women and men, and that'll give us an idea of where their current level is. And then we can recommend from that what type of replacement.
You can send by me, it's fine.
That we would, what the type of replacement that we would suggest, and how often depends on the route of testosterone, so the delivery of testosterone. So Neil spoke about pellets, and basically to answer her question earlier, pellets are just a delivery method for testosterone. They are the consistency of aspirin. They look like a Tic Tac, essentially. No,
Oh.
they are implanted in usually the upper outer quadrant of the buttocks area, just subcutaneously under the skin. And,
Time release?
they
Yeah,
are, yep.
yeah.
They're broken down over time, depending on the person. They can get them either every, 3 to 4 months to every 5 to 6 months, depending on the patient and what our goal is. So that is the more superior method of delivery of testosterone replacement on the market right now. There's also
It's relatively painless too. I mean,
yeah.
it sounds like one of those things that's really invasive, and honestly, like I've had it done, I don't know, 6 or 7 times
Yeah.
now. It's not bad. I mean, it's really not bad at all. A day or so, you're going to be a little sore, and after that, it's pretty much business as usual. So it's not a major inconvenience in terms of pain or being out of commission.
Right. And then, along with testosterone, sometimes there's other hormones that you're deficient in that are just a supplement that you would add into that regimen as well, which, we would definitely go into more detail with you at a consultation, but, you're not just one hormone, so it's all about a balance. And testosterone really is a primary for men, and believe it or not, women. Everybody thinks women are estrogen, but there's a book over there by Dr. Moak about testosterone for women and how important it is. And testosterone actually produces estrogen in the body. So when we're in our youth, that's our primary hormone, and that's why we're feeling so good. And oftentimes it's completely ignored. So it's very important across the board.
Yeah, it's really about the balance.
Did that answer your question somewhat, sir?
Yeah, pretty much.
Okay. Yes.
Okay, actually two. I'm already on thyroid medicine. Would that affect that?
No, actually we check thyroid as part of the panel because a lot of symptoms can be similar, and thyroid is a hormone. So sometimes, you might think, oh, it's my thyroid that's causing all the fatigue, and maybe it's, the other hormones or vice versa. So we include that.
My other question is, I'm a breast cancer survivor and was estrogen based.
Okay.
I had to take tamoxifen and
Yeah.
all that stuff.
Right.
So how will that work or play with that? And would I have to go to my oncologist and say, can I do this?
Well, that's obviously your choice if you want to get approval. What we do is we block estrogen conversion. So testosterone can convert to estrogen in the body, but we have pellets that actually have anastrozole, which is an estrogen blocker, so it blocks any conversion to estrogen. So we do treat breast cancer patients.
So, I know it depends what you're going to be dealing with individually, but approximately what's the cost and the insurance cover?
Insurance does not cover what we do, okay? So we only prescribe bioidentical hormones here, and basically what those are is they are molecularly milled to be identical to what your body naturally produces. They're plant-derived, primarily. So your body responds better to them than synthetic hormones. Synthetic hormones are covered by insurance, but typically when you go for treatment of synthetic hormones, they may just give you an estrogen patch or a testosterone cream that's not effective because it's such a low percentage. And those sometimes are covered, but then can carry a little higher risks than what we use. Our costs, it would depend on what you would need, and again, we could discuss it at a consult, but primarily what you pay for at our facility is just the medication. We don't charge for office visits. Any lab work is covered under your insurance, subject to your copay or deductible.
So you can't share any idea, sorry.
It's so individual,
You're
ma'am.
next, I promise.
Yeah, I'm sorry, ma'am. It's so individual that it really would be a consultation because what you need might vary versus somebody else. I'm sorry.
Go ahead in the back.
How does it affect your metabolism? Is it direct?
Yeah, I can definitely take this one. There is, and so the question was how it affects metabolism, and it definitely has a positive impact on metabolism. I can tell you when your hormones are not balanced, that's when you're going to see a lot of that, body fat gain and weight gain. It's that kind of slow, little by little gain that we all see as we age. A lot of that is attributed to hormone imbalance, and so. It's been my experience with myself and certainly with my clientele that have engaged with just a pretty good portion of it nowadays. I've watched their body fat and metabolism just get better and better and better and better. So it has pretty dramatic effect on it. Now, again, like I said, you gotta move, you gotta do your part too, but it will absolutely enhance all that stuff.
Just to tie into what Neil said real quick, it's a tool. Hormone replacement is a tool. It's going to help you get motivated. It's going to give you the energy to do what he's discussing because it's the exercise that's really going to get your metabolism going.
Right. So, go ahead.
After Dr. Moak's presentation last month, I went and had that tested at my doctor's office just to find out.
Yeah.
And came back, the answer was that it was not too low.
Okay. Yeah, you were in acceptable range.
Yeah, and so is that still something that you recommend to still take?
Well, and not too low
Yeah, right.
is a fine line. So it depends on the relationship the provider has with, hormone replacement. So if you look at a lab range, a hospital lab range for testosterone for men particularly, it's anywhere from 250 to 1100. So you can be at 250, which means you have every symptom of low testosterone, but you're still in range and your doctor will say you're fine. Or you can be 1100 and be feeling phenomenal. That's a huge jump.
Yeah.
Okay? So our treatment starts way before you get there, because when you get there, you're already in bad
the
shape.
idea is you don't ever want to get to that point where you're kind of crashing and burning and get ahead of the game, right? But you
yeah.
don't want to get too far ahead of the game, because if you're producing adequate natural, you don't want to shut that down. That's definitely not the goal, is to shut it down.
And what is your optimal compared to somebody else's optimal? We don't check people at 20 years old typically to find out what's
Yeah.
your optimal. You might have been 1,600 when you were 20 years old, where somebody else might have been 8. So when you get down to 800, you might be feeling like crap, and the guy, do you understand what I'm saying? So it's very different dependent on the person, and we're all different. So we have to look at how severe are your symptoms, and really where is that number to a hormone replacement specialist compared to maybe a primary care.
So how do you go about determining a man of a certain age where his baseline should be, where his ideal baseline should be, based on what statistic will tell you this man at this age, if he's an average health, should be, say, 800.
And we don't look at that, because a 70-year-old man, I've seen a 70-year-old man in the 600s, and I've seen a 70-year-old man in the double digits. So there's no like range, like this 70-year-old should be here, or this 60-year-old should be here. There's, it's kind of like, what are your symptoms?
It's not like a one-size-fits-all
it's a
kind of
very-
approach. It's
hormone
not saying you're
replacement's
60 years old, you should be at 600. Like, it doesn't.
Right. We have an optimal level for men in general that we look at. Like, where do men feel optimal? And that does vary with delivery approach, but I'm going to say 700 to 900 was a typical optimal range for men, where they feel good.
So you would know by saying testing me, for example, that I should be at this, because you're just going to gradually, you're going to say, here's where you're at right now, but we're going to take you step by step ladder to see where you feel.
Well, we do know we know based on average and how many, I got to say thousands of men we've treated over the years as to where they feel good, at what level. And like I said, there's a range. Like, let's say 700 to 900 is a range. It runs a little bit higher with pellets. What I see on average, where men fall, where they feel good. And that's what we do. It's men across the board. It's not the 60-year-old, the 50-year-old, the 40-year-old. It's men across the board. Where do they feel good, and what is our average range for those men? Yeah.
Facebook
We have
Live?
a question from the Facebook audience, from Tracy Amanda. Do you test VIA blood? And also, how do we find out more information?
VIA blood? Oh, via blood, yeah.
Via blood.
Yes, we do test via blood. The question is, do we use blood? I know different doctors, some use saliva testing, serum testing is blood. There's different ways of doing it. We use blood because it's covered by insurance, and really, we can follow those values just as well as saliva. So information, they can contact our office at Allure and schedule an appointment for a consult. Our number's on the web, but it's 586-992-8300, and they can schedule a consult to discuss it further. Any
You have in the
more?
back? Yeah, go ahead.
I have a treadmill at home.
Okay.
And I get on it 30 minutes every day.
Okay.
Are you saying that I need more exercise besides walking to build muscle?
I am, yeah. The cardio, so the way it works is the cardiovascular stuff, which would be like you're walking, could be biking, could be a row machine, could be stairs, could be anything that's basically not weights, isn't going to build a lot of muscle mass. It's, like I said, it's really good for your cardiovascular health, it's really good for all those things, but you really don't build a lot of muscle or metabolism with that cardiovascular exercise. So that's kind of where I was at with, you got to kind of split your time between weights and cardio as well, and get the two together to get really those optimal results out of it.
Okay, and I also had the pellets inserted.
Okay.
And wow, what a difference.
It's pretty incredible,
great,
isn't it?
great.
It is it sounds almost like cliche to talk about how it is life changing. Yeah, like you have that energy to go right, and so to your point, right, exactly. So, but how great did it feel to be able to want to get on your treadmill and do that? Like, I'm sure before you struggled with that, right? I'm sure it was not the same. Yeah. Well, good. I'm glad you're. Well, of course. Yeah, there's nothing wrong with that. There's nothing wrong with that. So, go ahead. He was next.
When you're working out, how do you break through some plateaus in your weight training?
So I can tell you, I mean, the single biggest problem typically is that you've been redundant with your program. I see a lot of people in the gym, in terms of the people that get to the gym and get there regularly, most people get their, 7 or 8 exercises for upper body or lower body, and they do those because they're comfortable. And typically the best way to get out of that little funk and get through those plateaus is you got to mix up your programming. Mix up the order of your exercises, pick some exercises that you haven't done in a while, change it up. You should definitely not be doing the same workout 2 to 3 times in a row. You can probably get away with that, but by the 3rd or 4th time, you're going to start to adapt to that, and your body doesn't really get the stimulus that it needs. So what you really need to do is, even if it's as simple as if you just took your same workout and did it in reverse, it would affect you dramatically different, right? Yeah, just because that order of operations and neurologically, your body's going to be very off balance, and you'll make good gains. Now, down the road, at some point, you got to introduce some different movements to keep your body, kind of guessing at things. But that's the single biggest thing to break through those plateaus is you got to switch it up. Yeah, good question. Somebody else was back there. Yeah, go ahead.
So kind of on the rep thing.
Yeah.
I've heard different things.
Yeah, that's like it's been debated for ever.
Heavier rep. Heavier weight, less rep.
Right,
like,
builds more muscle, less weight.
So what is like the general?
So, and that's why I said, someone at 12 to 15 is going to kind of cover everything, right? When you get into sets of 20 or so reps, you're getting into kind of pure endurance training. Will you build a little bit of muscle doing that? Absolutely, you will. If you're training down in that 5 to 8 range, it's really more like true strength training where the adaptations are more neurological than they are, muscle-based.
The weight should be like just.
Yeah, so that's why I say like in that 12 to 15 range, it should be hard. You should be burning. You shouldn't be able to get to 20. So try to live in that 12 to 15 range. It's a pretty good sweet spot that applies to almost everybody. I mean, very rarely, unless I'm training somebody who's really like power-based that's, maybe like a sprinter or something, will I go below it. And if I'm training endurance athletes that are maybe training for marathons and I really want to build that, huge aerobic component, I'll go a little bit higher. But for the most part, I'd say at least 90% of the clientele and the people I work with, we live in that 12 to 15 range. Yeah, so good question. Anybody else? Yeah, go ahead.
Michelle, so with the hormone replacement therapy, is the hair loss and then hair growth in other spots that we don't want it, is that all part of covering that?
Okay, so her question was with hormone replacement, do you experience hair loss and hair growth, and does it fix that hair loss and hair growth? Okay, so hair loss, not necessarily. I mean, there have been patients who've noticed thickening of scalp hair, according to some of the studies that Dr. Mokes read. I feel like if people come in with hair loss, if it's not thyroid related, or sometimes we'll check another hormone called dihydrotestosterone to see if it's related to that. If it's not related to hormones, sometimes it's a genetic factor. If it's hormone imbalance, we can work with it, but there's no guarantee. Sometimes it is a genetic factor. With hair growth, sometimes people think, if I'm a woman and I take testosterone, I'm going to grow hair. Sometimes women come in and they're, getting chin hairs or whatever because they are actually hormone imbalanced. So that can just happen with age, unfortunately. But does it fix it? Sometimes. It just really depends on the situation. I know that's not a very clear answer, but it's just very dependent on what's causing it. But we do try to work with, everybody we have on the team here at Allure. We have a dermatology, we have a regenerative team that does like PRP for hair loss and stuff. So we try to find the cause and treat it accordingly.
Anybody else?
Okay, I have a nutrition question.
Let her go in the back real quick. Go ahead.
So does muscle weigh more than fat? So like,
Substantially more.
they get caught on this, how much weight you got.
Yeah, the scale thing. So yeah, the scale thing. Like, if I could throw out scales for everybody, I would. I really do. Like, I have a guy that I just started working with about 6 months ago. He was like 350 pounds, and he hasn't been on the scale yet. And he's like my favorite client I've ever had. And I guarantee he's probably down 60 or 70 pounds already. And to absolutely answer your question, yeah, fat weighs. In terms of its density. If you looked at a pound of muscle, it's pretty small. And I wish I should have brought it. I have a 5-pound fat model. It's big. It's a lot bigger than you think. So that scale number is really kind of skewed. The most important, real, true number is body fat percentage. It's huge. There's scales out there. I think you guys have a machine here that tests body fat quickly, right? That's by far the best measure of what's actually going on. Because if you go lift weights and you gain that 5 pounds of muscle, and you lost 6 pounds of fat through that process, and you get on the scale and you're only down 1, it doesn't feel very good. It doesn't look very good. And it's very discouraging. And I've had that happen I mean, literally hundreds of times over the course of my career, and the answer is always the same. We go back, we do a body fat, and then I can show you, okay, yeah, you gained this amount of muscle, you lost this amount of fat, and it's a lot better way to gauge your progress than just the scale. The scale is really not the best indicator of what's going on, especially if you start weight training, even more so if you've never weight trained before in the beginning. The scale's probably not going to move a lot, but you'll notice your clothes are going to fit better. All those things get better pretty quickly, but the scale in the beginning with weight training is sometimes detrimental to your brain in terms of the progress. So.
I just did the 90-day fitness challenge with Powerhouse.
Oh, okay, yeah.
And when I was meeting my measurements, I was losing,
Yeah, inches like crazy, right?
but I gained an inch in my head.
Your butt got you built you.
I'm like, wait.
Well, what happens with that is like your glutes actually got bigger, and so that measurement looks a little bigger because you have a butt now, right? Which again can be scary, but again it goes back to that body fat percentage, and once you see that number, it makes it
The scale was not doing anything.
no,
But I was seeing the arms and the thighs.
yeah. And I mean it's frustrating when that scale's not moving and you're like going for it,
People will give up a lot of times if they don't see the scale
Oh my God,
moving.
yeah, no, seriously,
Yeah.
I know. Yeah, and honestly, it's like one of the first talks I have with people when I ask them and they don't have much experience with weight training. I'm like, look, just so you know, the first month or sometimes even 5 or 6 weeks, that scale is not going to move a lot. Everybody gets really bummed. I'm like, we're going to take measurements. There's other ways of tracking this progress, and people are buying new clothes, and that scale still says the same. So it could be frustrating. So go ahead.
Oh, I'm sorry, she.
Yeah.
It's kind of like, you hear all about the keto.
Yeah, keto's hot right now.
But
It is. Keto's hot right now. It is. It's probably it's the biggest trend in the diet industry. It's everywhere.
but is it something to really, I mean,
Okay, so
good things and bad things?
yeah, and listen, you could pretty much pick a diet, and I could give you a strong point and a weak point. From my personal perspective, I don't love keto. I don't think it's really super highly sustainable. At some point, I think with diet, much like all things, you got to learn how to control yourself, right? And that's the single biggest thing with nutrition is, until you figure out how to control your bad habits, I don't care what diet you engage in for that amount of time, you'll be successful. But at some point, if you revert back to your old habits, that diet didn't do anything, and most people end up gaining more. And you play that yo-yo game, and it's obviously super discouraging. So. Do I love keto? No. Well, if you did it and you stuck to it religiously for the first month, you would be successful. You would see benefit.
You probably do it your entire life.
Yeah, and again, right, and again, this is going to be kind of opinion based, but in my opinion, I don't think it's a reasonable thing to think that you're not going to eat carbs for the rest of your life. At some point, you need to learn how to eat carbs and enjoy them responsibly. Right? Like, there's foods I can't have in the house because I'm not responsible enough to have pretzels in the house because I will eat them till they're gone. Oreo cookies, I'll eat a bag, right? So I'm not responsible to have certain things in the house. But that doesn't mean I don't eat carbs. You still have to learn how to control that bad behavior. So no, I don't love keto. That's kind of where I'm at.
And
with
I know
that.
at our last talk, we did talk about keto a little bit, and Dr. Moak said, if you want to use it as a kickstart for a weight
Yeah.
loss plan, you'll lose quite a bit of weight. Maybe
right.
do it for a month, but then you have to transition
Yeah,
to
at
something
some
that's
point,
sustainable.
You got to learn how to eat like a grown up,
Yeah.
and it's not easy. So you had a question, I believe?
It's just about HRT.
Yeah, go ahead.
Once you start, you do this for the rest of your life.
You can do it for the rest of your life. So usually people who get on HRT, they feel so good, they want to stay on it. I've had patients go off to see how they feel, and then they usually return.
Yeah, so I
because,
tried that. I
the-
tried that route, and it didn't work.
Yeah, and the longevity that you get, the stamina you get, my older patients are just so much more youthful. I have a patient, I have a woman who's 85 years old.
for her.
And she's been on hormone replacement with us for years, and she actually trialed off for a little bit to see how she'd do. And her primary care doctor sent her back because he noticed that her mind was starting to slip. And that's one thing with HRT. It is pretty good for the brain. We see there's studies, against like dementia and stuff like that. So she started again, but she feels great. If you met her, you would never ever guess she was 85 years old.
You go ahead.
If the natural hormones are so much better, then why don't the doctors go with it? And why are the insurance companies covering it?
Yeah, we actually had this. Insurance companies used to cover our hormones when we first started. It's a lot to do with, I think the big business, pharmaceutical industry, stuff like that, that I won't get into too much, but they say they're not FDA approved. Basically, the FDA doesn't have regulation over compounds, and they're all compounds. And doctors just don't know. They don't know what they don't know or what they're not taught. So they are taught, synthetic hormones, and they're taught, they hear a lot of the stuff that, old studies, maybe they're not up to date on the recent studies because that's not their specialty. It's a specialty.
It's a progressive mindset.
Yeah,
it's
just
a
like
progressive
anything
mindset.
else. It's definitely, a more integrative approach and more just a healthier way of living. And, it's nothing against them. I have physicians as patients. I have OB-GYNs as patients. They're coming to us to learn because they want to learn how to treat their patients. So we either have completely for or those that are against, that they have just not extended their knowledge. But we do see, physicians, PAs, nurse practitioners as patients for hormone replacement.
Go ahead.
Just wanted to know, like, the general age, I guess, at which you would say you would start maybe someone to come in.
Right. No, so everybody's so uniquely different.
Yeah.
Again, hormone replacement is such a gray area, but I can tell you personally, just because I was here, I started checking my hormones at 35, and I was already progesterone and testosterone deficient. So, and some people, have symptoms of this early, you hear of like severe PMS symptoms, PMS, PMDD, which is the severe PMS, people who get endometriosis, or, there's different conditions that are definitely a sign of hormone imbalance that can start young. PCOS, you hear of PCOS, which is polycystic ovary syndrome, and that's a hormone imbalance condition. So that can happen at young ages. So we do treat, younger women, we treat perimenopause and we treat menopause.
So I feel like a lot of doctors kind of go like, oh, you're not sleeping, you're probably this, like, you will come.
Right.
Not really testing those kind of
Yeah.
things.
Well, I mean, the blood work tells the tale, right? I mean,
So it is.
Right, for sure. Yes.
Does HRT help in, let's say, degenerative discs?
no, it's not really going to affect that kind of structural tissue in your body much. No, unfortunately. I wish it did, but it doesn't. Yeah. Stem cells. Stem cells, that's where you want to be for all that kind of stuff, for sure. So, anything else?
Are there any side effects or downside to taking the HRT?
For bioidentical hormones, there's no side effects, only symptoms of deficiency and excess. So deficiency are the symptoms you come in with. Excess might be oily skin, maybe some acne, stuff like that, but no side effects.
Have you seen any relationship between the women coming in for HRT compared to their birth control use when they were younger?
Not really, no, and they're so very different because birth control is synthetic, and I think a lot of times women are put on birth control to regulate their systems, where it's not really regulating them, it's just kind of causing synthetic cycles and stuff like that. So I guess not really a correlation there. Any more questions?
No, I think we're
You guys
good.
ready to have a raffle?